Okay. So we only have 21% of you voting. If the rest of you would take a moment to join our poll, that would be great. Okay, anybody else wanting to vote on this? If the answer is I don't know, that's good information for us as well. Some of you may be having difficulty getting to your computers, and we're just going to wait a couple minutes.
This is Karen. You closed the poll.
Oh, well,
that's why you only have 21% who voted. So,
reopen it. Can we reopen it?
See if you can open it again. No.
Oh, that's really too bad. Well, with 21% of you voting, 56% of you said no, 19% of you said yes, and 25% said I don't know. I'm going to sort of probably overwhelm Debbie, but ask those of you who didn't vote or weren't able because we accidentally closed the poll, if you could please send in that information via the actually, if you could do it in the chat box, that would probably be more helpful, and Karen could calculate that for us. So you could just in the chat box put yes, no, or I don't know, and list your county. That would be great. Thank you so much. Okay, so moving on. To the next slide. We then looked at the training of peers in California. What we do know is that California does not have a statewide standard. It does, however, have several organizations that provide training and credentialing. We have peer-operated training organizations, there are parent-provider training organizations, as well as a number of community colleges and universities throughout the state providing training, as well as certification, in particular certificates under human services programs. Some counties train their providers, their peer providers, simply by using their standard in-house trainings. One of the things that we did find is that the number of training hours required ranged from 12 to 480 within the training programs that we looked at. So a wide, huge diversity in the number of training hours. These are some samples on your screen of California credentialing programs. So, for example, the Family Youth Roundtable provides a peer support certification. This is for people working within the children's system of care. Recovery Innovations, which is a peer-run organization, provides their peer employment training, which is being very effectively used in Riverside. United Advocates for Children and Families provides a Parent Partner 101, as well as an education, equip, and support training. San Francisco City College provides a community mental health worker certification. And Spirit in Contra Costa, which was originally run by a peer-run organization and is still run that way, but in collaboration with Contra Costa College, also offers a peer mentoring certificate. So what we see is a number of organizations providing training, certification, and a number, dozens and dozens of curricula. What we did for our study was to look at a crosswalk of 8 different curricula. So we wanted to see what do those curricula have in common. And what we did is we reviewed 3 consumer-operated organizations, 2 family/parent provider organizations, 2 community colleges, and 1 statewide curriculum. And we wanted to evaluate what were the commonalities across those. What we found in the curricula of those 8 different curricula was that there were 62 discrete topic areas. Because those topic areas, many of those topic areas had to do with specific practices specific to systems of care or age of person served, we actually were able to condense the categories to 17 broader categories. Once we did that, we found that 70% of the curriculum content occurs in at least half of the curricular review, suggesting that there's a great degree of overlap in the curriculum already created. Again, just to point out that particular services or practices were condensed into one category called practices. And so that helped us to get a grasp on what was unique and what was similar across the curricula. What you see on your screen now is the categories that we were able to create that were common. And so what you see, for example, here is that law, ethics, and boundaries were provided by all 8 curricula. Interpersonal skills also was a topic area in all the curricula. Many of the curricula included culture, history of movements, self-awareness, defined practices, which are those things, again, that are specific to the system of care or the person being served. What this tells us is that there are a number of curricula already in existence that have developed good content areas for the provision of training to peer providers. So moving on to, given all this information, we wanted to look at, okay, well, what is the, given what we know about the practices in California in terms of hiring, classifying, training, peers, what do we think the benefits of certification would be if there was a statewide certification created? We know that it would standardize qualifications for peer providers. And again, when I'm saying peer providers, I mean it would standardize qualification for those people providing services as a parent partner, as a family member, or as a person with direct lived experience, so that each of those discrete providers would have standardized qualifications. It would, of course, ensure consistency and quality of training of providers. And since we already know that there are a number of curriculum that are similar, we already have a strong base in California for providers of training or curricula. We also think that it will encourage counties to create civil service positions specific to peer support, so that the validation of having a statewide certification would be useful to county mental health departments in working with their civil service requirements in creating specific job categories and codes. It also would have the effect of validating the importance and the role of peer-provided services. It would also ensure that to our consumers, people who receive our services, the family members, parents, and people receiving services as mental health consumers, it ensures that they would be provided a high quality and effective service. And we are now going to stop here because we've gone through a lot of information and ask for questions on what we've been talking to so far.
Okay, we have Sylvia Perez. I'm going to unmute her.
Sylvia, you're unmuted if you'd like to ask a question.
Oops, I'm sorry, I'm
I'm sorry, just a second. Sylvia, we're looking for you. Oh, Sylvia, you may be on a not have mic access. We're unable to unmute you, but you could, if you ask your question in the question box, we'll look for you there. Anybody else who would like to raise their hand to ask a question?
Okay.
So we'll wait just a couple of moments while people are gathering their thoughts and wanting to ask a question about what are the current practices in California. And another thing that would be helpful to us is if you have any comments on the benefits of peer support as well, that would be helpful.
This is Karin, and I have just launched the poll again on whether you have Medi-Cal services, whether you bill for Medi-Cal services for peer providers.
Great, Karin. I can't see that on my screen, however.
I see it over here.
Oh, okay. So everybody else can see it besides me. That's great.
So if everybody could please register their vote on, does your county currently bill Medi-Cal for services provided by peer providers? We have 68% who voted either yes, no, or you don't know. Appreciate it.
Jeffrey, we're going to try to unmute you because we're not sure what your question is. So we're going to try to unmute you if you could ask that question online while people are voting. Okay, Jeffrey, you're unmuted now.
But Jeffrey doesn't have a microphone.
Oh, well, that's problematic.
Yeah, the CASRA certificate is what.
Oh, CASRA, okay. I'm wondering if you're asking about the CPRP, which is the certification for psychiatric rehabilitation practitioners, and you would think I wouldn't trip over that since I happen to be one. And that is offered by USPRA, the United States Psychiatric Rehabilitation Association. That's a very good question. We've been asked that a couple of times, and my response to that is I value and respect that credential. It actually is a credential that focuses on rehabilitation services, which may include but are distinctly different than peer support services. So while there is some overlap, the CPRP is really a credential or a certification that's stating that you are qualified and in fact an expert in providing a specific set of services called psychosocial rehab. And that's a very valuable thing, and many peers may want to do that. When we're talking about a peer support certification, or whether it's a parent, a family member, or a person with lived experience. We're talking about using your peer experience specifically to create a relationship of mutuality that creates a deep level of empathy and understanding because of the shared lived experience. That would be different than a CPRP. However, I think it's important to realize that people who with lived experience or parents or family members may also want to get a CPRP to become expert in providing rehabilitation services, since there is some overlap there. So they're not mutually exclusive, but they are also not the same.
Okay, so we have, will trainers be certified, and how do you envision the training being provided to local peers throughout the state? Richard Sanguinetti.
Hi, Richard. That's is wondering about whether trainers will be certified, and actually we're going to talk a lot about certification and what the recommendations were from the stakeholders in the next webinar. But just briefly, yes, there was a lot of conversation about that providers. There are a couple of qualifications. Training providers should include individuals or similar individuals providing the training. So if you're a parent partner, you need to be trained by a parent partner specialist. And that, yes, there would be requirements of training organizations to meet content and to have a curricula developed. But what the stakeholders said was that they wanted a wide variety of groups to be able to provide training, but that there be specific content areas, modalities, and type of trainer involved.
Richard has a second question. Do we have a sense when the statewide certification will be available?
When will statewide certification be available? That's a very complicated question. In order to do statewide certification that is recognized as a billable service, this goes through the Department of Healthcare Services, and they work with the Centers for Medicaid and Medicare to authorize peer support as a service that can be billed to Medi-Cal. Again, we're going to talk a lot about certification in the next webinar, but we really don't know the answer directly to when is this going to happen, because it's a really very complicated process.
We have a question from Rigel. Was there a breakdown of what peer positions throughout the state were regarding people with lived experience, and what percentage were family members?
I don't think we do actually have that information. We can go back into the research and try to figure that out. But I will say that my recollection was that there are quite a number of, there are more family and parent providers than we had expected to see. There are quite a number of them. I don't think it equals the number of consumer peers. One of the other things that we did notice is that it did seem that of the counties that we looked at, it appeared that counties were able to include parents or family members into new coded positions easier than they were able to provide a specific coded position for people with lived experience. Because we saw more positions, more family and parent positions that were specifically coded as such than we did peer support for people with lived experience.
All right. We have a question from Darcy. How can we build in the perspective of people we are serving as far as quality and developing the standards? And her comment is, what seems to be covered by most of the curriculum may not be meaningful to people receiving services.
Well, this is what the stakeholders throughout the state had input on. And again, this is something we were talking about in our second webinar, where there was a question about what curriculum should be included in a certification program. We do have that information. We also have information from across the country about what other people are including in their curriculum. So that's a big issue that we've been looking at, and we're going to share that more in the next webinar. And then at the summit, we're going to be asking people to further input about what the curriculum should include. So the list of curriculum that we showed you as far as what's currently happening is there is a more expanded and refined list that's being developed as the stakeholders have input. Carol West is asking about the number of peer support specialists who are paid versus volunteers, and no, we don't have that information. And again, because we're a county system, each county does things differently, and so it's hard for us to get that information. Comment. Yeah. So the Luis Blanco is making a comment that's real important. Is that he's often given the feedback that people who are hired into peer support specialist jobs often enter realizing that it was not what they expected. And this is a common problem. And it has to do with what Debbie was talking about earlier. It has to do with really sitting down and figuring out what is it that, what is the value and the scope of practice of peer support. How then does that fit into our existing workforce? How then do we train our workforce to understand, accept, and value that role? So that counties that go into this not understanding the very sophisticated nuances that they need to pay attention to often run into this difficulty. And what we've seen across the country, or across the state, is that well-meaning counties will hire people into positions without having prepared their workforce, without having fully investigated the complications that are going to arise when you hire any new person with a different scope of practice. So this is an issue that is really has to be looked at, and the stakeholders have looked at that issue, how to maintain peerness on the job, how to create environments that are welcoming to those new employees. So excellent question, and that is something that the certification project has been looking at.
Okay, from Juanita about specialized traits of people with cultural backgrounds that are different.
Yeah, and Danny Marquez asked this question earlier about culture. I think the peer support certification process certainly would include valuing culture-specific interventions. And I think that's what you're asking about, that in order to be a peer, that is going to include some issues involving worldview and cultural identification, and so those things will need to be valued as part of peerness as well. Yeah. There's another question here about the concern that if we have a certification, will some peers then no longer be able to provide services because they are not certified for whatever reason. And the stakeholders have spoken very strongly about this, and the general consensus among the stakeholders is that we want to provide as much flexibility as we can. So that, for example, a county may want to have some positions that are peer providers that are not certified, as well as having some positions that are certified, as well as then creating career ladders that allow people to advance beyond the first level of peer support, to allow people to become supervisors and even to move laterally into non-peer positions. The stakeholders also did provide recommendations on the grandfathering in of peer providers who have already been providing services, and how might they be grandfathered into a certification process. And again, that's something that we are going to further talk about in the next webinar and seek further stakeholder input at the summit on how people would like to see grandfathering in occur. Interesting. A question about from Jeffrey about from Craig about how will peers who have other professional status fit into all of this. One of the things that we've seen across the country, for example, is one state has peer support specialists who are also LCSWs. So we are mindful that that you might have lived experience as well as other qualifications that may put you into different positions within the workforce. And we do see the workforce starting to, actually we've seen a huge increase of traditional workforce employees disclosing their own mental health backgrounds. And that's been a real positive trend. How that gets built into what the workforce looks like down the line and how that relates to peer support versus some other kind of service is still to be determined by stakeholders. And we'll be talking about that at the summit as well. So some folks are asking about whether their existing certifications from other bodies would be accepted as part of peer, the statewide peer certification. And again, I'll go back to the issue of inclusiveness, and that the stakeholders really want to not exclude people who already are doing this work, already have previous certifications, perhaps from a community college. So it really is going to be a very inclusive process. So that, for example, if you have a certification already from a community college that meets the standards of the curriculum content and the values of peer certification, that you may be able to be grandfathered in under that certificate. Last question is, once a peer is certified, can he or she become an independent contractor to offer services? That would really be an issue for a state plan amendment, and in what ways could peer support specialists provide services? So that really is an issue that would be talked about between the Department of Healthcare Services and the Centers for Medicaid and Medicare. My sense is at this point there is no mechanism for people other than the licensed professionals identified by the federal government, those being psychologists, psychiatrists, LCSWs, MFTs, and the new, there's a new one in California. Those are the credentials that I know can set up private practice, and I am not sure how that would work for peer support specialists and what systems that would have to go through in order to set up private practice. So we're going to have to,
we have some more questions, but I think what we want to do is perhaps save them for the end right
Okay.
now, just to make
Yeah.
sure we get
So
through.
because of time, we're going to continue on, and we do see that there are some other questions and people have their hands raised, and so we will try to get to those at the end of the webinar. So we're going to move on to, just real briefly, what's going on nationally. What we know is that up to 35 states throughout the country are providing certification for consumer peer support specialists. We also know that there are between 6 to 8 states, and Fran, who I know is on the call, may have an updated number about this, but there are 6 to 8 states that provide a family peer support certification. And we know now that Georgia is the very first state in the country to be offering a whole health peer certification. We do know that there are other states that offer things like a forensic peer support specialist as well as co-occurring peer support specialists. The main point here being that nationally this has been going on for quite some time, and California is a little bit behind but could pull ahead and surpass the rest of the country with our innovation. But what we saw was that nationally, the main reason for looking at certification was connected to the ability to bill Medicaid. So basically what you had was a situation where you had parent, family, and consumer movements within states that then began wanting to provide services, and then when counties looked at this, they wanted to figure out how you could bill for those services. So in virtually all of these states, certification is tied to the ability to bill Medi-Cal. What we know is that the Centers for Medicare and Medicaid established guidelines for peer support in 2007. Those guidelines acknowledged that peer support is considered an evidence-based model of care, and they set out some pretty general guidelines, and those are that states have to develop a plan that includes how will these people be supervised, how will peer support be part of the overall care plan so that there's coordination, and how will you train and credential peer support specialists. This varies quite dramatically across the country, and the reason for that is that the federal government really is very careful to not set specific standards for each state because they value innovation and ingenuity and acknowledge the need to meet specific needs of specific communities. So what we see across the country is that we have training hours that range from 40 to 100, that for continuing education units, some states require 12 hours annually, and other states require up to 30 hours every 2 years. In terms of supervision, we see that some states require that a licensed qualified professional be a supervisor, but other states require that the supervisor is themselves a peer support specialist. We know that care coordination can be accomplished in a number of different ways so that peer providers can actually provide services in clinics, existing clinics, as well as in peer provider organizations. And really all that's required is that those different members of a multidisciplinary team coordinate their care so that peer support is included on the treatment plan. And that, again, can be done in innovative ways so that not all team members are sitting at the same table, but you may have a psychiatrist at a county clinic, a therapist at a county clinic, and peer support may be provided in a standalone peer-run organization. The next slide that you're looking at is an example of a set of states that are offering certification and the number of training hours that they provide. What you can see is that in New Jersey, they require 100 hours of training, all the way down to a number of states that require only 40 hours of training. This, again, is the beauty of allowing for innovation and ingenuity so that different states have been allowed to do, employ different practices to meet the unique needs of their own counties. Or, I'm sorry, to meet the unique needs of their own states. So we're going to stop here with the national picture because we're going to go into a lot of that because it relates to certification in the April 30th webinar. And we're going to move now to talk about the whole health peer support. And Deb's going to do that for us.
Well, first off, we have our second video of the morning, and so this is a redacted video that gives you some important information from the Pillars of Peer Support Services Summit number 3, in which they did a lot of talking about whole health and peer support. So we hope you enjoy this video.
Whole health peer support has been remarkable in empowering peers to help each other live longer and healthier lives.
We have an obligation to look at individuals as peers ourselves and to continue to focus on recovery. We've been working for a number of years on peer recovery support services, both in the mental health and addiction recovery fields. And as we've been developing opportunities,
I think, first of all, I'm a believer in what the leader cares about tends to happen in organizations, in movements, and in associations.
We're the first workers who's come since the shift in beliefs and our strengths and what we can do recovery. It's a workforce that lines itself up well to the whole person in recovery, putting the mind, the body back together.
Peers being health coaches, being peer coaches, being people who teach whole health. Time has come for peer services to play a mainstream role in our care system.
The role of peers is one of the more exciting innovations that I've heard of in the last 40 years that I've been involved in mental health. It bridges an important gap where people with lived experience are able to share their experiences, particularly their experiences of recovery, with people's record on that path to recovery.
You have to be there. It's really hard to take advice from somebody who hasn't lived what you have and offer to walk and you're telling them to do something. But if that person's been through the same thing and come out to the other side with a positive outcome, or even understands the negative outcome and can share that space with you, it's a lot more difficult.
Well, ultimately, most of health occurs outside of doctor's offices. So it's going to be necessary to help people improve self-management of their illnesses and self-prevention. Peers are logical part of the workforce to be able to live and increasingly part of the workforce to this community.
I think peer support peers is a wonderful opportunity going forward with the Affordable Care Act, which is very friendly. Whole health is very friendly services, very friendly to patient-centered care.
We are developing focus groups to go out to the community, and when I say we, I mean peers and thinking leaders are going out, they're developing the questions, the format down, they're going out to the community and engaging them to hear what the values and what they would really like to see in integrated care.
This is the time at which we can enhance the regulations, the strategies that state and federal governments have put in place to address care for people with chronic disorders, including mental illnesses, and the ways in which those services and supports effectively. At a time we really need to take a look at our entire mental health workforce needs. This is an exciting innovation. The fact that it's now into the evidence-based realm adds to the attractiveness of peers as a workforce that states throughout the nation should be looking at is very viable.
A very viable piece of the work that we're going to be doing indeed. I'm sorry, I hope that you were all able to hear by turning up your own volume, hear the video. It was on max volume on my end, so but we did get questions about that. So very briefly, this is the beyond that was in our title of our presentation today. It's going into the future, what the Affordable Care Act offers as opportunities. So in it, mental health and addiction services it's mandated that those services are provided. Also that primary care, mental health, and addiction services are integrated. This is good news overall, but it is new, and it is going to take some work for us to have that integration be what we want it to be. In the Affordable Care Act, it is very much emphasizing patient-centered care. The Act also is emphasizing the need to educate primary care providers. There's going to be money available to support this, and that education is particularly going to be necessary for integrating special populations, including chronic disease management and the treating of vulnerable populations. And so the education of primary care providers about mental health and co-occurring disorders from a recovery, wellness, and resiliency point of view is going to be very, very important. So the healthcare field has already really recognized the strong evidence base for peer support. They have been using peer support within their peer support groups around specific issues people face, like heart disease, like cancer, and education is already being provided for healthcare issues within the healthcare field. So in that sense, they should be ready for this expansion. So peer support specialists that come with the knowledge of mental health and substance abuse challenges are really going to be a vital addition to the healthcare field, and we hope that they'll be utilized for a whole variety of roles. Here's some of the roles that could be provided. So outreach and engagement, assistance with access to services, bridging activities to assist with maneuvering in the new system. It's going to be different. This healthcare home is going to create some changes, and people are going to need some help with that. Again, as we said, education of primary care providers, and as well as implementation of wellness and prevention strategies, which we have so much experience with in the mental health and co-occurring disorders fields. We want to just, as we're wrapping up here, talk about Georgia's expansion into whole health coaches, and that Lucinda referenced earlier. The goal in their certification for whole health coaches is to expand the members' lifespan, so directly addressing that people with mental health disorders die at a much younger age than the average population.
So to expand the lifespan by promoting wellness and recovery and healthy lifestyles, reducing identifiable behavioral health and physical health risks, increasing healthy behaviors intended to prevent even the onset of disease, and lessening the impact of existing chronic health conditions. The interventions that are done by wellness coaches are, you'll find, similar to the kinds of peer-provided services that we've talked about earlier. So they are support for people in building skills. They provide this kind of support and coaching about daily health choices, so you get some real hands-on assistance in making the lifestyle changes that are important to make. They promote effective skills and techniques for wellness and self-management, and help to develop wellness goals and provide ongoing support for their achievement. So with the idea that coaching is kind of an ongoing process, it's not a single intervention or a single class that's taught. It really needs to be ongoing, and that's the coaching part. I thought you'd be interested in what the curriculum at Georgia covers in terms of the 10 whole health and resiliency factors. That's part of the curriculum that's been developed. So you'll see there's just the hardcore basics on the left: stress, healthy eating, physical activities, and restful sleep. And then I think the other ones broaden to include some factors that are really clearly important and much more holistic in terms of approaching health issues, including spiritual beliefs and practices and a sense of meaning and purpose, which I think are also part of a holistic view of life, and important for people to get some skills and strategies around. To wrap up today, we want to mention that there are best practice guidelines for certification, and this is in preparation for our next webinar, April 30th, and that Karen will be sending out the actual document to people on the call today. And this document is important because, again, the pillars of peer support outlined what really is necessary to create a certification that is top-notch, that is going to create the outcomes and be as effective as we know it can be. So we encourage you, once you get these best practice guidelines, to take a look. And also, we encourage you to come to the next webinar. We have really enjoyed having you on the call today. And we've got, we're going to have a little bit more time for conversation. But on April 30th, we'll talk a lot about statewide certification, a lot about Medi-Cal and the state plan amendments that are being discussed. And you'll also hear what the stakeholder recommendations have been to date. So let's go for our last round of questions. And again, thank you so much for being here today. Did we want to say how the polling turned out?
Yeah, that's a good idea while we're waiting for new questions. 83% of people voted, and 35% said that yes, their county is billing. So we're gonna look at that information and see if we can figure out what that means. I don't know if Karen, if you've got a chance to do that. 42% said no, and 23% said they don't know.
So that's interesting.
Yeah, very interesting. So I don't see any hands. I see Jennifer Churchill's hand raised.
So we'll unmute Jennifer, please. All right, Jennifer, you are unmuted. Jennifer, if you, I know that you had written some questions in. Since we can't seem to get audio, if you wouldn't mind typing in your question. Thank you. Thank you for asking your questions. Lucinda is continuing to check for new questions. So far we are not seeing any new questions. One thing is that people were asking about the PowerPoint and whether that would be available, and yes, we will create a PDF document and again ask that Karen would send that out to people. Also, Karen, there was a mention of the WWT website not working this morning, so we will also check into that difficulty, and hopefully you'll be able to get access soon.
Yes, this is Karen, and I checked the website myself, and yes, maybe it's because we've had so many people going to it, I have no idea. Hopefully it will be up again soon. And I want to let everybody know that yes, I will send out all the materials, and I want to strongly ask you to complete the evaluation. It's not very many questions. At the end of this webinar, it's going to be extremely important for us to get that information on the evaluation of how we did this, so that we can improve it in the future.
Thank you, Karen. We have James. We're going to unmute you, James, and see if we can hear your question.
Hi. Yeah, this is James. Hi. My question is about scope of practice, and you said earlier that there is money for training or education for primary care providers. And as this process goes along, will we be able to define more clearly what we'll be able to do in terms of as a whole health coach in the individual wellness centers, what we can do where people don't feel that we're going in above and beyond what our qualifications are?
That's a very good question, and that conversation is going on at many different levels currently around how is California really going to implement some of these requirements. And I know there are a number of people, some of whom are on call, that are trying to make sure that peer specialists are included in all of those roles, in being able to provide navigating, in being able to be a whole health coach, being able to work with primary care doctors on education. So I know that work is being done. I don't know if anybody has information on how people might get involved in that, and to make sure that the peer voice is being heard loudly in order to influence the decisions that are being made. So basically those decisions are kind of being made right now, but we are hoping to be able to offer a whole health peer certification for people who are interested in actually providing that service.
So let's say if an individual received the whole health certification portion of this, I was told that the goal is ultimately in the wellness centers that peer specialists would be able to, if they're doing whole health, they could take blood pressures, they could talk about, co-occurring, comorbidities and co-occurring disorders and things like that in a very general context. So anything on that, I mean, in terms of?
Well, again, that would really be up to how the scope of practice that DHCS and CMS would allow. And what that means is that we, as the people the peers that want to be involved, really need to be speaking to the people in power to make sure what we want is included. And I'm still waiting to hear from either Karen or Joyce